do you think we're going to see an explosion, like just a huge number of apps come out on top of this? I mean, we're talking about, I think four or 500 hospitals at this point that have connected
Health
in.
record. Yeah.
Do you think we're going to see an explosion of apps on this, or is it going to be slow?
So I think what we see in the App Store in a lot of cases when it comes to, you know, quantified self and personal health kind of applications, there are a lot of people that download them and use them once or twice, and they're not sticky, or they don't do the thing that the person kind of hoped that they would do or wanted them to do. And so when it comes back to sort of average daily user count for those applications, there's lots of them, but lots of them that aren't used. So really very few of them are used. I think we'll probably go through a similar cycle with this. I think there's a couple of paths here, right? And I don't know that the electronic health record vendors are going to maybe like this idea very much, but I think the idea of the electronic health record on the consumer side, on the customer side, and you know, you heard me rant and rave about we really shouldn't talk about them as patients, they really are customers. On the consumer side, on the customer side, I think we're going to see this path where they're going to get better access to their records, the data in their records, and then using apps that we're going to have a lot of developers are going to have to struggle through this to figure out what really works and what doesn't work. But ultimately, they're going to be able to see their data in different ways that works for them, given that we're all individuals and we all have different ways of wanting to consume data. Sort of another version of personalized health, right? I'm going to be able to use an application that drives the data to me in the way that I need it, that leads me ultimately to live a better, more healthy lifestyle. That's one path that we're going to see. And the EHR vendors really in that scenario are just going to be the data repository for the data. I think there's going to be another version of this that happens on the provider side with FHIR and APIs and lots of other things like that, not necessarily Apple, but there could be lots of ways that this will come about. I think you'll see the same thing. There are lots of, you know, between transplant and lab and rad, and, you know, we've all gone to, or many of us have gone to best of suite electronic health records. What if you could layer on top of that a bunch of applications that let you as a provider see data and use data the way that you really want to use it? And again, the EHR just becomes the underlying infrastructure, database infrastructure to feed those apps.